Understanding Adenoids, a comprehensive guide. Hey everyone, Dr. Mike here, and welcome to today's video. Today, we're diving deep into the world of adenoids. Whether you're experiencing symptoms yourself or know someone who is, this video is packed with valuable information to help you understand what adenoids are, what causes them to become problematic, and most importantly, what you can do about it. We'll cover everything from symptoms and causes to treatments and supplements. Make sure to watch till the end for important tips and recommendations. Chapter 1. Adenoids, what are they? So what exactly are adenoids? Let's dive into this fascinating topic. You know, we hear that word thrown around a lot, especially in the medical field, but what does it actually mean? Adenoids are often mentioned in the same breath as tonsils, but they serve a unique purpose. Well, adenoids are essentially small masses of tissue located right at the back of your nasal passage, kind of like little guardians of your airway. They are part of the lymphatic system, which is crucial for our body's defense mechanisms. Now, you can't actually see your adenoids by just looking in the mirror. They're tucked away up there in your nasal cavity. This hidden location makes them less known compared to other parts of our body. And you know what's fascinating? Adenoids actually play a crucial role in our immune system, especially during childhood. They are most active between the ages of 3 and 7, when our bodies are learning to fight off infections. They act like little filters, trapping germs that we breathe in and preventing them from getting further into our bodies. This is particularly important for young children who are constantly exposed to new pathogens. Think of them as tiny bouncers, keeping those unwanted pathogens out of the club. They stand guard, ensuring that harmful bacteria and viruses don't get a free pass into our system. However, as we grow older, our adenoids tend to shrink, and by adulthood they often practically disappear altogether. This is because our immune system has matured and doesn't rely on them as much. In fact, many adults don't even realize they had adenoids at one point. Historically, adenoids have been a subject of medical interest for centuries. Early physicians noted their role in respiratory health, and modern medicine continues to study their functions and importance. For parents, understanding adenoids can be crucial, especially if their child experiences frequent infections or breathing issues. Knowing that these small tissues play a big role can help in making informed decisions about their child's health. So the next time you hear about adenoids, you'll know they're more than just a medical term. They're tiny but mighty defenders of our health, especially during our early years. Chapter 2. Recognizing the symptoms of adenoid trouble. Now, let's talk about when these adenoids, these little guardians in our throat, start causing problems. Adenoids are part of our immune system, helping to trap harmful bacteria and viruses that we breathe in or swallow, but sometimes they can become more of a hindrance than a help. When adenoids become infected or irritated, they can swell up, and that's when the trouble begins. This swelling can be due to repeated infections, allergies, or other irritants. Imagine a narrow hallway, and suddenly there's a big, bulky object blocking the way. This blockage can make it difficult for air to pass through, leading to various symptoms. That's what happens when your adenoids become enlarged. They obstruct the airway, making it harder to breathe normally. This can lead to a whole host of uncomfortable symptoms, and you might notice these in yourself or your child. It's important to be aware of these signs so you can seek appropriate medical advice. One of the most common signs is difficulty breathing through the nose. This can be particularly noticeable at night, leading to restless sleep or snoring. It's like trying to breathe through a straw, and it can be really frustrating, especially for kids. This constant struggle can affect their daily activities and overall well-being. This often leads to mouth breathing, which, let's be honest, nobody enjoys. Mouth breathing can cause dry mouth, bad breath, and even dental issues over time. It's crucial to address these symptoms early to prevent further complications. Chapter 3. Unraveling the causes of adenoid issues. So, what causes these adenoids to become inflamed and swollen in the first place? It's a question that many parents and patients often ask. Well, in many cases, it all boils down to infections. These infections can be caused by a variety of pathogens, including bacteria and viruses. You see, those pesky viruses and bacteria that love to wreak havoc on our bodies can also target our adenoids. When they invade, they trigger an immune response. When this happens, the adenoids become inflamed as they try to fight off the invaders, leading to the swelling and blockage we discussed earlier. This inflammation is a natural part of the body's defense mechanism. It's like a tiny battlefield back there in your nasal passage. The adenoids are working hard to protect your body from these harmful invaders. Now, children are particularly susceptible to adenoid problems, and this is a common issue seen in pediatric healthcare. That's because their immune systems are still developing and learning to fight off infections effectively. Their bodies are in the process of building up defenses. It's like they're still in training camp, honing their skills and learning how to combat these infections. Meanwhile, those viruses and bacteria are seasoned veterans, always ready to launch an attack. This makes it a challenging battle for young immune systems. Understanding these causes can help parents and caregivers take better care of their children's health, ensuring timely medical intervention when needed. With proper care and attention, adenoid issues can be managed effectively, allowing children to lead healthy, active lives. Chapter 4. Now, the good news is that there are effective treatments available for dealing with troublesome adenoids. One approach is to focus on strengthening the body's natural defenses, and this is where natural remedies can play a significant role. Garlic, for instance, is a powerhouse when it comes to boosting the immune system. It contains compounds with potent antimicrobial properties that can help combat those pesky infections targeting the adenoids. And then we have propolis, another natural wonder. Propolis is a resinous substance collected by bees, and it's chock full of antioxidants and anti-inflammatory compounds. It's like nature's own antibiotic, helping to soothe inflammation and fight off infection. Chapter 5. Now, it's important to remember that while natural remedies can be very helpful, there are times when professional medical intervention is necessary. If you or your child experience persistent breathing difficulties despite trying natural remedies, it's crucial to consult with a healthcare professional. They can assess the severity of the situation and recommend the most appropriate course of action. In some cases, a tonsillectomy and adenoidectomy, which is a surgical procedure to remove the adenoids, may be recommended. This is typically considered if the enlarged adenoids are causing significant breathing problems, recurrent infections, or other complications. Chapter 6. Now, in addition to natural antibiotics like garlic and propolis, there are other supplements that can provide valuable support for your body's natural defenses. Vitamins A, B5, B6, C, and E are all essential for maintaining a healthy immune system. Think of them as the essential nutrients that keep your immune system soldiers well fed and ready for battle. And then we have zinc, a mineral that plays a critical role in immune function. Zinc helps to activate immune cells and supports their ability to fight off infections effectively. It's like the armor that protects your immune system's warriors. So incorporating these supplements into your diet can provide that extra layer of defense against those pesky infections. Outro, that concludes our comprehensive guide to understanding adenoids. We've covered the symptoms, causes, and various treatment options available. Remember, knowledge is power, and by understanding your body and the potential causes of discomfort, you can take proactive steps towards better health. If you found this video helpful, please give it a thumbs up and share it with your friends and family. Don't forget to subscribe to our channel for more informative content on health and wellness. Thanks for watching, and I'll see you in the next video.